Thank you for joining us today for the presentation, Medicare and your UC-sponsored Medicare plan. My name is Ronisha Roberson, and I'm one of the healthcare facilitators. Myself, along with my colleague, Lilia Huato, we service the UC San Diego campus and health, faculty, staff, retirees, survivors, and their dependents with healthcare-related issues. Before we dive into the Medicare content, let's discuss exactly what the healthcare facilitator team does. As I stated, we assist the faculty and staff, retiree survivors, and their dependents with healthcare-related issues. These issues can be helping with billing problems, providing a detailed comparison for your benefit options when you have complex medical conditions, intervening on your behalf with health plan representatives, and explaining how Medicare benefits coordinate with your UC-sponsored medical plans. Now, this is just a brief part of what we do, but this is not all that we do. So if you feel like there's something that the healthcare facilitators can help you with, don't hesitate to reach out to us. If you have questions, you may put them in the chat. However, there will be a live question and answer session at the end of this presentation. And we know that Medicare can bring up a lot of questions. However, throughout the presentation, I believe that most of your questions will most likely be answered as we progress. So our content for the day is going to be the basics of Medicare, what UC's requirements with Medicare, UC's Medicare plan options, the plan premiums. We're going to do a couple of question and answer sessions to test your knowledge, and then we'll provide some tools and resources at the end. First, we're going to begin with the basics of Medicare. Medicare is a federal program that provides healthcare coverage for individuals who meet the following criteria: the age of 65 or older with over 10 years of work experience or 40 employment credits. This is most common for those that are UC members. If you're under the age of 65, you may qualify if you are disabled as determined by Social Security, or you have been receiving Social Security income for a minimum of 24 months. If you have end-stage renal disease or ALS, also known as Lou Gehrig's disease, you may also qualify. Medicare plays an important role in coordinating with your UC retiree health benefits, in covering the costs of your healthcare costs as you age. If you're like most people, when you turn 65, you will become eligible to enroll in Medicare, the federal program to provide older adults and those with disabilities or permanent kidney failure with secure access to medical care. UC offers two types of Medicare plans: Medicare Supplement and Medicare Advantage plans. We will discuss these more in detail later in the presentation. To make sure you have the right coverage and to avoid Medicare premium penalties, it's important to understand the rules and enroll properly. All the information you will need is located in the UC Medicare fact sheet located on UCNet. Now let's review the parts of Medicare. Medicare is made up of 4 parts. Part A covers hospital inpatient care, skilled nursing and hospice care, and home health services. It's usually premium-free if you, your spouse, or your ex-spouse have worked full-time for 10 years and paid Social Security taxes. If you qualify through your spouse or ex-spouse, you would need to have been married a minimum of 10 years. Part B is medical insurance. Part B covers your doctor's visits, ambulance services, labs and x-rays, physical therapy, durable medical equipment, and preventative care. You will pay a monthly Part B premium to the Centers for Medicare and Medicaid Services, or CMS, or it can be automatically deducted from your Social Security income if you're receiving that income. Part C is not necessarily a component of Medicare, rather a type of Medicare health plan, also known as Medicare Advantage plans. Medicare Advantage plans are health plans offered by Medicare-approved private companies that contract with Medicare to provide you with all your Parts A, B, and D benefits wrapped into one. The UC offers Part C plan designs, which we will cover a little bit more detail in the presentation. And then we have Medicare Part D. The Part D is the outpatient prescription drug benefit. Most UC retirees do not pay an extra premium for Part D unless they have a higher income. The UC coordinates your Medicare with your UC Medicare plan. The UC plans include that outpatient drug benefit or Part D coverage. The prescription drug coverage of UC medical plans is equivalent to or better than Part D original Medicare plans and is considered creditable coverage. The formulary for prescription drugs may differ from your non-Medicare plan, so remember to review your evidence of coverage booklets for more detailed information. Enrollment in another Part D plan may result in loss of UC coverage. Retirees with Medicare must complete a form, the UBIN forms, to enroll in prescription drug coverage, and we'll discuss that again later on in the presentation. Most plans with Medicare prescription drug coverage, or Part D, have a coverage gap that you may have heard of called a donut hole. This means that after you and your drug plan have spent a certain amount of money for covered drugs, you may pay all costs out of pocket for your prescriptions up to a yearly amount. UC does not have this clause. As stated in the previous slides, all of your Medicare plans have Part D coverage included. Therefore, no additional Part D plans are required. Do not enroll in a separate Part D plan if you enroll in a UC-sponsored Medicare plan, as duplicate coverage is not allowed. The exception to this enrollment is the UC Medicare PPO plan without prescription drugs, or having triple coverage through UC, Medicare, and CalPERS or TRICARE for life. If you are 65, chances are you qualify for Medicare. If you're retired, UC offers several plans that coordinate with Medicare. Often this coordination means that you pay less for certain medical expenses that you would if you only had standard Medicare coverage. If you're still working at UC, your UC employee medical plan generally remains your primary coverage, even if you enroll in Medicare. However, you may still need to make some decisions about Medicare for yourself or a family member who is turning 65. If you're under 65, these plans may also be available to those with special qualifications. When you enroll in Medicare, you'll need to ensure that your Medicare premiums are paid for you to keep your Medicare coverage and therefore keep your UC coverage. If you fail to pay and maintain your Medicare, you will lose your UC coverage. This slide shows the premiums and dues that you may need to pay in order to maintain your Medicare coverage. So we have the standard Medicare premiums, which are generally taken out of your Social Security check. And if you're not receiving Social Security, you will be billed quarterly. We also have the late enrollment penalty. This is for the retirees that have not paid or enrolled in Medicare. If you enrolled in Medicare Part A and not Part B when eligible, you will receive a late enrollment penalty, which is 10% of the premium added to your monthly premium every 12 months that you were not enrolled. For Part D, the late enrollment penalty is 1% if you don't have credible coverage for 63 or more days. And then we have the IRMA, or the Income-Related Medicare Adjustment Amount. A small percentage of Medicare enrollees, less than 5%, are required to pay a higher premium for their Part B and D coverage based on their previous year's tax return. And we'll show that in the next slide. Failure to pay the adjusted higher amount will result in loss of coverage. Here are the Medicare premiums for 2024. There was an increase this year of the standard premium amount of $9.80, making the new premium for 2024 $174.70. Now that's the base premium for those making $103,000 or less filing an individual tax return, or $206,000 or less with a joint tax return. Your Medicare premiums are based on income from 2 years prior, so 2024 rates will be based on your 2022 income, and 2025 rates will be based on your 2023 income. Most people who qualify for Medicare receive Part A premium free if they paid into FICA taxes for a minimum of 10 years and have those 40 employment credits. If you have less than 40 employment credits, you will pay a premium. For those who have 30 to 39 credits, the premium is $278 per month, and those with 0 to 29 credits, the premium is $505 per month. Medicare Part B will always have a premium. The more income you make, the higher your premium will be. As you can see, for the base premium for Part B, the premium for Part D is 0. And as you see from the chart, the premium increases as the income increases. Also, as with Part A, most have a premium-free Part D, unless they are in a higher income bracket. We want to make sure that you note that you will pay this Medicare premium in addition to your UC medical plan premium. No matter if you're enrolled in a UC plan or an original commercial Medicare plan, you will always pay 2 premiums: Medicare Part B, straight to Medicare, and a Plan B premium. If you're not eligible for Medicare, you will need to provide proof to the UC that will allow you to remain covered under a non-Medicare plan, but keep in mind you may qualify another way. If you do not have the required 40 work credits, you may still be able to qualify for premium-free Medicare Part A based on your spouse's work history if they have 40 credits. This is known as a spousal benefit or spousal coverage. You will qualify for premium-free A under your spouse's work history if they are 62, have the 40 work credits, and either of the following: you are currently married and your spouse is eligible for Social Security benefits, either through retirement or disability, and you must have been married for at least 1 year before applying. If you are divorced and your former spouse is eligible for Social Security, either through retirement or disability, you must have been married for at least 10 years, and you must now be single and not remarried. If you are widowed and married for at least 9 months before your spouse passed, and you must be single. It is very important that you know the facts about Medicare and UC's requirement when it comes to Medicare to avoid any penalties, and that Medicare fact sheet booklet should be your go-to for all Medicare information. If you're already collecting Social Security income, you will be automatically enrolled in Medicare Part A and Part B 90 days before your 65th birthday. 90 days before your birthday, Social Security will send you your Medicare card reflecting this enrollment, and premiums will begin to be deducted from your Social Security income. If you are not collecting Social Security, you should begin applying 90 days or 3 months before your 65th birthday. You may apply in person, online, or by calling Social Security. If you have been denied Medicare, request a denial letter and notify the UC. You will then stay on one of the non-Medicare plans. Coverage will begin the first day of your birth month, unless your birthday is the first of the month, and in that case, your coverage will begin the first of the preceding month. Outside of being automatically enrolled through Social Security, there are 3 additional enrollment periods. The first is the initial enrollment period, and that's when you first become eligible at the age of 65. That is a 7-month period. That's 3 months before your 65th birthday, the birthday month, and then 3 months after. The second is the special enrollment period, which is usually the period those who are still working will enroll during. This is when most UC members apply. You would qualify for enrollment during the special enrollment period when ending your employer group health plan coverage and you are over the age of 65. The special enrollment period is an 8-month period. That 8 months will begin the first day of the month that your employee coverage ends. And the third is the general enrollment period, which is anyone who missed the other 2 enrollment periods would enroll during. If you are enrolled in Medicare Part A and Part B and terminated due to non-payment, the general enrollment period is when a member should enroll in Part B. If you're enrolled during the general enrollment period, it is only open during January 1st to March 31st of each year, and your coverage will begin starting July 1st of that year. If you choose to enroll during the online option, this is the landing page for the Social Security website, www.ssa.gov. This is the page you will go to when you sign up for Medicare. You can also check your accounts to see how many work credits you have, check your application status, and obtain replacement Medicare cards. The Medicare experts outside of the healthcare facilitators are the Social Security Administration, and they're the experts on enrollment, eligibility, premiums, and ID card replacements. The Centers for Medicare and Medicaid Services, or CMS, they're the experts on service, claims, coverage, and how to understand your explanation of benefits. And then we have HICAP, or the Health Insurance Counseling and Advocacy Program. And they're the experts on helping people understand their Medicare and resolve any Medicare issues. Now we're going to dive into what UC's requirements for Medicare are. Enrolling in one of the UC-sponsored plans subsidizes often and lowers your medical plan premiums. Remember, no matter if you choose to enroll in the UC-sponsored Medicare plan or an outside original Medicare plan, you will always have to choose a plan and pay the premium in addition to the Medicare premiums you pay directly to Social Security. UC requires that all retirees over the age of 65 enroll in Medicare. If you're eligible for premium-free Part A, you must enroll in Part B. Enrolling in Medicare allows UC to offset the costs of insurance and pass those savings down to you, the retiree. In order to enroll in a UC-sponsored Medicare plan, you must enroll in Part A and Part B, and your Medicare card must reflect both with start dates. Failure to comply with this requirement will result in penalties and permanent loss of UC-sponsored medical coverage. There are 2 exceptions to this, which are those who retired prior to July 1st, 1991, due to them not paying into Social Security, and those retirees who live outside of the U.S. where Medicare is not required. If you move back to the U.S., UC will require you to enroll in Medicare so that you may have a Medicare late enrollment penalty. Again, you can obtain all the information you need from that Medicare fact sheet booklet located on UCNet, or you can scan the QR code to bring up the fact sheet. Your employment status will determine when you or your family member will need to enroll in Medicare. If you're eligible for Medicare, you are still working and do not plan to retire, your Medicare enrollment is optional. Some employees will enroll in Part A because it is premium free and delay Part B because there will always be a premium that you will have to pay. But again, this is optional. For Kaiser members, you can do the same and delay your Medicare enrollment. However, if you're enrolled in Kaiser and you have a lot of out-of-pocket expenses, enrolled in Medicare Part A and Part B may benefit you. If you consistently spend more than what it would cost for your Medicare Part B premiums each month, it may benefit you to enroll and pay for Medicare Part B. By doing this, Kaiser will waive all your co-payments. Kaiser is the only plan that will do this while you're still an active employee. The only plan that is not compatible with Medicare is the UC Health Savings Plan. You cannot enroll in any parts of Medicare. If you do, you must contact UC Path as an active employee or UC Raise or a benefits representative to enroll in a different medical plan. Medicare also has different rules for domestic partners. So if you have a domestic partner, they will need to contact Social Security before their 65th birthday for information on how to apply for Medicare. If you have questions or are unsure, please contact Social Security directly. If you are 65 or older and planning on retiring, if you or an enrolled family member is 65 or older at the time of your retirement, the RASC will send you a Medicare packet given you've checked the Medicare eligible checkbox on your PRP or your personal retirement profile. The Medicare packet will include instructions on how to enroll in Medicare. Next, you and any enrolled family members who are eligible for Medicare will need to complete the CMS L564 form and take it to Social Security to enroll in Medicare during your transition to retirement. The healthcare facilitator team can assist with completing these forms. Once you're enrolled in Medicare, you and any eligible family members will need to complete the appropriate UBIM forms to assign your UC plan to the Medicare Partner Plan and return these forms to the RASC. You must include a copy of your Medicare ID card. If you plan to retire in July and you are eligible for Medicare, and you should start applying for Medicare on or after May 1st and request your coverage to begin on August 1st. What happens if you're turning 65 and already retired? In this case, the RASC will send you an aging in packet approximately 90 days before your 65th birthday, and this will include information and instructions on how to apply for Medicare. Once you're enrolled and have your Medicare ID card, you will need to complete the appropriate UBIN forms to assign your prescription drug coverage to the UC-sponsored Medicare plan and submit that to the RASC. So if you are in core at the time of you turning 65, you will automatically go to UC Medicare PPO. For UC Blue and Gold, UC Medicare Choice is your Medicare plan. For Kaiser, Kaiser Senior Advantage is your Medicare plan. And for UC Care, UC Medicare PPO is your Medicare plan. And as we stated previously, if you're enrolled in the UC Health Savings Plan, you must switch to one of the other plans as it is not compatible with Medicare. Here's an example of the timeline to enroll in Medicare. For this example, the person is already retired and aging into Medicare in the month of April. In the month of January, UC will send you the information. Your Medicare will begin the 1st of April. You have January, February, and March to complete the paperwork and submit it to the RASC. If after April 1st, you didn't have, or after April 30th, you have not completed your paperwork, for 3 months after that, you will be assessed the late enrollment penalty of $419.60. And again, if you're not eligible for Medicare, request a denial letter from Social Security and notify the UC so you can stay in your current non-Medicare plan. Remember, UC Medicare enrollment is a two-step process. You must first apply and enroll in Medicare, either going online, calling and applying over the phone, or walking in person to your local Social Security Administration office and having them assist you with enrollment. After you are enrolled, you must submit your UC forms by providing proof of Medicare enrollment. It can be the approval letter or your Medicare ID card, and then complete and submit the UBIM forms or complete the life change event in UC Raise and upload your UC forms there. So this is an example of how to enroll via UC Raise. So you'll log in, select retiree insurance, you'll select life events and assign Medicare, and then you'll review your life events changes screen. You will click Initiate Life Events Change, and on the next screen, select Medicare Assignment. Enter your Medicare information, check the enrollee Part A and Part B boxes. On the Review Update page, you will see your UC contribution amount. Then you'll choose your Medicare plan. Be sure to check the Medicare box and click Calculate Total Costs for you to see your costs and reimbursements if qualified. On the Medicare questionnaire page, you would fill out the application, check the arbitration boxes, and review any important notices. On the Review and Confirmation page, you would check the box and confirm your enrollment, and then you will be sent a message to sign. Now, UC offers a variety of Medicare plans, and these plans include both Advantage plans and supplemental plans. You can receive offers to enroll in non-UC Medicare plans, even from insurance carriers like Kaiser that do work with UC. These offers are for individual Medicare plans, which may not cover all of the benefits offered by your UC group plan. So consider carefully before making any plan changes. You may only be enrolled in one Medicare plan at any one time. If you have any questions, please contact the RASP or your healthcare facilitators. Medicare options depend on where you live. So for Medicare eligible retirees and their family members who reside in California or a California service area, the plan options would be Kaiser Senior Advantage, UC Medicare Choice, UC Medicare PPO with and without prescription drugs. And although high option is not available at the time of retirement, it does not have a Medicare partner. So it is only available during the open enrollment period, and all members must be enrolled in Medicare. Split families or retirees who have some family members in Medicare and others who are not, who move outside of California but remain in the U.S. will be eligible for the split UC Care, UC Medicare PPO plan, or Core and UC Medicare PPO. However, retirees who move outside of the U.S., outside of California, but remain in the U.S., and all family members are eligible for Medicare, they will transition to the Medicare Coordinator Program administered by VIA Benefits. If you plan to move overseas and you are Medicare eligible, then UC Care and Core are your plan options as they offer international coverage. Since Medicare is a federally funded program, Medicare plans are not available when residing overseas. As stated in the previous slide, you may receive information and offers from an individual Medicare plan. While there are some similarities, UC's coverage offers more than an individual plan would. This is because UC's Medicare plans are designed specifically for UC retirees. As you can see from the chart, a lot of the individual Medicare plans do not cover as much as the UC plans do. There are different enrollment periods. You have the annual election period for individual Medicare plans that occurs between October 15th and December 7th. Individual Medicare plans are generally available to anyone on Medicare with your plan within your plan area. You are responsible for handling enrollment and disenrollment, and enrollment into an individual Medicare plan may disenroll you from your UC Medicare plan. And then UC Medicare plans generally can be changed during open enrollment period. UC's Medicare plans are only available to UC employees who are eligible for retiree health benefits, and there are no pre-existing condition exclusions. And you may change your plan every year if you're not happy with the plan that you're currently enrolled in. And remember, you can only be enrolled in one Medicare plan at a time. So if you would like to enroll in an individual Medicare plan, you must suspend your UC Medicare plan coverage. When shopping for Medicare plans, you have two coverage options. Option one is our Medicare supplement insurance or Medigap insurance plans. These plans helps you pay some out-of-pocket costs not paid by original Medicare, so Parts A and Parts B. And Medicare is your primary, and the supplemental plan is your secondary. And then a separate Medicare Part D plan. We do have option ones available at UC, and that's the UC Medicare PPO with and without prescription drug, and the UC High Option Supplement plan. And then the option two is your Medicare Advantage plans or a Part C plan that combines all your Part A, B, and D. It may include some additional benefits such as glasses, gym memberships, and worldwide coverage. And there are additional benefits depending on the insurance plan. We do have option twos available at UC, and that is the UC Medicare Choice PPO and Kaiser Senior Advantage plans. Retirees and some family members that are eligible for Medicare and others that are not, you would be considered a split or a mixed Medicare family. Those who are enrolled in Medicare will enroll in the Medicare plan that is the partner plan for the non-Medicare plans. The non-Medicare members will enroll or stay enrolled in the plans on the left. The Medicare members will enroll in the plans on the right. Remember that the retiree's plan drives the dependent plan. For instance, if the retiree is non-Medicare and enrolled in UC Blue and Gold, their spouse that is Medicare eligible must enroll in UC Medicare Choice PPO. And remember, if you are enrolled in the Health Savings Plan, you will need to choose another plan. The UC's PPO supplemental plan is UC Medicare PPO with or without prescription drugs. If you are currently enrolled in CORE or UC Care, your Medicare plan will be UC Medicare PPO. With the supplemental plans, Medicare is primary and Anthem Blue Cross is your secondary. Your supplement plan pays 80% after Medicare for most services. You will pay deductibles and co-insurance. And you must receive care from Medicare certified providers. Make sure to ask your current or possible providers if they are currently accepting new Medicare patients. High Option, UC High Option is also a supplement plan, and it's only available during open enrollment when all members are enrolled in Medicare. So this is the UBIN form that is needed for all the supplemental plans. It is the UBIN 123. The effective date of the UBIN is based on the date that your form was received. If you choose to enroll in the UC Medicare PPO without prescription drugs, you will also need to complete a UBIN 100. The UBIN 100 is going to be based on the date. The effective date is based on the date it's received as well. For High Option, you can enroll during open enrollment, and all members must be enrolled in Medicare, and most of your services are paid at 100% after the deductible is met. The benefits of enrolling in one of the supplemental plans is you can go to any provider that accepts Medicare. You do not need a referral for any specialist visits, and it offers global care for retirees traveling and living abroad for up to 6 months. You can also access preventative care, emergency care, and prescription drug coverage while traveling abroad. Now let's look into the UC Medicare Advantage plans. Under the Medicare Advantage plan design, you assign your Medicare to a Medicare-approved insurance carrier that must follow strict rules set forth by Medicare. Whenever you visit your provider will bill your insurance carrier directly. Under this plan design, you will not have a deductible and you will pay co-payments for services. UC currently offers 2 Medicare Advantage plans. The first is Kaiser Senior Advantage, administered by Kaiser Permanente. and it is a Medicare Advantage HMO plan design. This means you must stay within the Kaiser network and referrals are required to see a specialist. The UC Medicare PPO plan administered by United Healthcare is a Medicare Advantage PPO plan design. This means you have the flexibility to see both United Healthcare and Medicare providers, and you do not need a referral to see a specialist. The provider, however, must accept Medicare and the United Healthcare plan. For Kaiser Senior Advantage, the Medicare form is the UBIN 127, and they have northern and southern coverage depending on your zip code. Again, the effective date of the UBIN form will be based on the date that it was received. The benefits of Kaiser is many qualify for that Part B reimbursement depending on your UC contribution amount. It's coordinated as an in-network model. There is an eyeglass benefit. The premiums are lower, and so are the out of cost for this plan. And it offers worldwide emergency coverage. For United Healthcare, the UBIN 121 is the UBIN form needed for this plan. And again, the effective date is based on the date received. The benefits of this plan is many will qualify for that Part B reimbursement depending on your UC contribution amount. There is a dedicated line special for UC members. The out-of-network costs is covered at the same cost of in-network providers. There are lower premiums and out-of-pocket costs, and they are offering new hobby classes for this plan as well. For the health savings plan, we did speak about this a little bit earlier, but once you become eligible for Medicare as a retiree, you must choose another plan. The health savings plan is not compatible with any parts of Medicare. If anyone in your family becomes eligible for Medicare, you must contact the UC and enroll in a different UC-sponsored plan. You must stop contributing to the health savings plan the month Medicare coverage begins, and the funds in your account will not be lost, and you can continue to use those towards eligible expenses. Now, at the age of 65, you can take a distribution, but it will be taxed as normal income. It is your responsibility to ensure that you meet the health savings plan requirements, as UC will not know about your Medicare enrollment unless you inform us. As stated in the previous slide, if you're enrolled in the health savings plan when retiring, you must choose any of the other UC Medicare plans from the list here and submit the coordinated UBIN form. If all family members are enrolled in Medicare, high option is another option. With the deductibles, once the deductible is met, most services are paid at 100%. Via benefits. If you reside outside of the state of California and all members are enrolled in Medicare, your benefits will be administered through Via Benefits. Via Benefits is UC's Medicare Coordinator Program for retirees living outside of the U.S. If you're eligible for this program, all retirees and all their family members that are covered must be eligible for and enrolled in Medicare Part A and Part B, but not due to a disability or end-stage renal disease. They must be the age of 65 or older. Live in a U.S. state outside of California, be eligible for UC's retiree health insurance, and submit the form UBIN 100. Via Benefits can be contacted directly by using the number listed here. And when contacting them, please remember to mention that you are part of the UC community. If the family is living outside of California and all are not eligible for Medicare, they must enroll in Anthem UC Care, Core, or the UC Medicare PPO. They must submit the UBIN 100 and the UBIN 123 forms. Retirees enrolled in Medicare plans through Via Benefits will have the choice to choose local plans to the city they reside in and a plan that meets their health and budgetary needs. Each family member can select their own plan and receive personalized assistance from the customer service representatives at Via Benefits directly. UC will provide an annual contribution for each covered family member under a health reimbursement account based on graduated eligibility. This amount ranges from $1,500 to $3,000 depending on the retiree's graduated eligibility. You may use these funds to pay for your medical premiums, prescription drug premiums, or even Medicare premiums along with other eligible expenses. You will be contacted by Via Benefits when you become eligible. If you need to make additional changes to your dental, vision, or legal plan coverage, retirees enrolled in Via Benefits must complete the UBEN 100 form. Now let's talk about those plan premiums. As an active employee, your premiums are based on your income or pay bands. Once you retire, your premiums are based on your service credit. Currently, UC shares the monthly cost of medical and dental coverage with eligible retirees up to a maximum contribution that varies each year depending on overall costs. Depending on which tier you fall under, retirees may be eligible to receive from 5 to 100% of UC's maximum contribution to premiums, also known as graduated eligibility. The amount UC will contribute depends on your retirement tier, your years of UCRP service credit, the level of coverage you have, the medical plan you choose, and if you're Medicare eligible. Years of service are based on whole years. So for example, if you have 16.9 years of service credit, your premium will be based on 16 years of service. This is an example of a retiree covering a spouse or a child, and everyone is in Medicare and enrolling in UC Medicare PPO. Your premium will be $180.42 per month. That will be deducted from your pension check. As you can see here, there is no Medicare Part B premium reimbursement for this plan. However, you can see both Kaiser and UC Medicare Choice, there is a Medicare Part B reimbursement. So let's quickly discuss the Medicare Part B reimbursement. Medicare Part B reimbursement may apply if your premium cost is $0. Part B reimbursements are based on Medicare Part B premiums of $174.70 per person. Reimbursement amounts vary and are added automatically to your monthly retirement payment. You still will pay the Medicare premiums as we discussed directly to Social Security. Then UC will reimburse a portion of that on your pension. Please note that the premiums that you see here are based on 100% UC contribution. This is a breakdown of a retiree covering a spouse or a child, both in Medicare. MM means 2 adults, or a retiree plus an eligible child, Medicare eligible child or adult, both enrolled in Medicare. The cost for the plan is $180.42. So the total monthly premium for that plan is $920.62. They have 20 years of service, so they're receiving that 100% contribution, which is $740.20, with the remainder being that $180.42. When they add that to both of the $174.70, so the Medicare payment of $174.70 for 2 people, out of pocket, they're going to be paying $529.82 per month, with the $174.70 times 2 going directly to Medicare and the $180.42 coming out of their pension check. In this slide, is a breakdown of costs using the UC Davis Retirement Estimator tool available on UCNet. This tool can help you understand what your share of your retiree medical and dental premiums might be. So this is one person with 100% UC contribution and someone with 50% UC contribution on the same plan. So you can see they go from plan 180.42 at 100% to $550.52 with only 50%. So as they say, it pays to stay with UC. As I stated, this is the retiree estimator tool on UCNet. Because the costs located on UCNet, as you saw in the previous slides, are based on 100% of UC's contribution. If you do not have 20 years of service credit or less than 100% UC contribution, you can download a copy of this retiree health plan premium estimator by visiting the link here on the screen or by scanning the QR code here. Once on the page, you would scroll down to retiree rates, open the 2024 UC retiree premium estimator. It'll open as an Excel spreadsheet. You would input your information, either inputting the percentage if you know it, or putting in your years of service, and it'll give you the total percentage of your UC contribution, and then you'll be able to see your premiums. For premium payments, Medicare premiums are paid by you, either out of your Social Security income, through Medicare Easy Pay, which is the online payment service, or through quarterly billing. UC's premiums for Medicare are deducted from your pension. And then the Medicare Part B reimbursements are a credit that's added to your UC pension check, and it's only available to those in the least expensive plans. So things to consider when choosing a plan. Check the drug formularies on the plan's website to see if your drug is there and if prior authorization for any prescription is needed. Match your priorities with what the plan is offering. If you need a specialist that is not in your provider network, are they available in another plan? Do a cost analysis on your out-of-pocket expenses, of what your out-of-pocket expenses may be if you enroll in that plan. And as always, review the evidence of coverage booklets that can be found on UCNet. Also, visit the Healthcare Facilitators Blink page, where you can read the fine print on the plans. You can also find recorded presentations and printed materials to assist you in the decision-making process. Some best practices for Medicare enrollment is to make sure you're using the correct and most current forms, complete them fully, sign your name. It should be a wet signature. Make sure the date is correct and the arbitration box is correct. If you do not check that arbitration box, they will kick back your UBIN form. Include a copy of your ID card with both Part A and Part B, or the letter from Social Security that highlights your Medicare Part B benefits, or Part A and Part B benefits, not the enrollment form. It has to be the letter that says you are approved with your Medicare number and start dates. Make sure all your premiums are paid to Medicare and to UC. Make sure your address is up to date. Medicare will not accept a PO box. It must be a physical address. Forms that are dated 90 days prior to the start date will not be accepted. And then they would expire 90 days after submission. The best way to track your forms would be to check your UC raise and that it was updated with your Medicare information. And any name changes or date of birth changes or corrections must go through Social Security. We want you to remember that qualifying for retirement and retiring is not a qualifying event to change your plans. However, there are some qualifying events that will allow you to change plans mid-year. That would be moving outside of your current plan service area, getting married or entering a new domestic partnership, having a newly eligible child or dependent, could be your grandchild or child or a new adoption, or involuntary loss of other coverage, or as we stated earlier, being enrolled in that health savings plan and aging into Medicare. If you don't experience a qualifying event, then you have the opportunity to switch plans during the annual open enrollment period, which takes place this year, October 31st, 2024 at 8 a.m. to November 22nd, 2024 at 5 p.m. Now, if you choose not to enroll in a UC-sponsored plan, you should complete a UBIN 100 form and suspend your UC medical coverage. In that case, no penalties will be assessed. Once you're ready to return to UC-sponsored coverage, during open enrollment, you can complete a UBIN 100 form and the subsequent UBIN form for the plan you wish to enroll in without having any penalties. However, if you choose not to enroll and you're out of compliance, that Medicare premium offset of $419.60 will be charged for 3 months per member. On the 4th month, there will be at risk for termination of coverage. So now really quickly, we're going to test your knowledge with a couple of questions. Barbara is celebrating her 65th birthday next month and plans to continue working another 3 years here at UC San Diego. Her coworker told her that she needed to enroll in Medicare to avoid being penalized. What should Barbara do about Medicare? Should she contact Social Security and enroll before her 65th birthday? Or can she delay enrolling in Medicare because she is enrolled under a UC-sponsored medical plan? If you said number 2, you are correct. Barbara will have a special enrollment period when she retires, and if she is covering a spouse, her spouse will also have a special enrollment period to enroll in Medicare. Then we have Anna. She is 66 and ready to retire. She worked for UC and never paid into Social Security and does not have the 40 credits to qualify. Anna's husband is 60 and has already earned his 40 credits. Question number 1, what will happen when Anna applies for Medicare? Medicare will tell her she does not qualify because she did not pay into Social Security and does not have the 40 credits. When should she reapply? She should reapply when her husband turns the age of 62. Now, she won't receive any new notifications to reapply, so it'll be her responsibility to note when she needs to reapply. If she fails to get Part B when she's first eligible, her monthly premiums may go up by 10% with that late enrollment penalty for each 12-month period she did not have Part B. She should put a calendar reminder for her husband's 62nd birthday and enroll in Medicare. Now, individual versus group UC coverage. Barbara is 68. She was watching TV and saw that the advertisement about getting $1,000 in grocery coverage under a new Medicare plan. She calls the number and signs up for a plan outside of UC. And then we have Milton. He's 72. He also received the mailers from Kaiser thinking that it's the same as his UC Kaiser plan. He calls Kaiser directly and enrolls in a Kaiser plan. How is each member's UC Medicare coverage impacted? In these cases, they are enrolling in an outside individual plan, not the group UC coverage, and that will make their UC plan void and they will be dropped from coverage. Remember, you can only have one plan at a time. If you receive anything in the mail that does not have UC logo on it, ignore it unless you plan on enrolling in an individual plan and you're going to suspend your UC coverage. Here are some tools. The Healthcare Facilitator team offers a monthly presentation, health insurance after you retire, and it's on the 3rd Wednesday of each month. And then we have, if you have outstanding questions following this presentation, there is a help desk to answer those questions every second and fourth Thursday of the month. And then there's a link here to Understanding Medicare on UCNet. Now, the RASC also has some resources as well. The member services number is listed here for any general questions. UC secure messaging, where you can submit forms, contact info updates, life changes, and enrollment can be done. UCNet, we've talked about it several times today, is your general go-to for resources with forms and updates as well. Open enrollment information will be on UCNet. And then the RASC portal, you can schedule retirement counseling, retiree resources, and newsletters from that link. And they also offer a monthly webinar for Medicare. The link is here, and they do have weekly Medicare question and answer sessions as well. You can register for that using the link there. Some additional tools. I know we covered a lot of information, but again, UCNet is your go-to for all information, open enrollment, evidence of coverage booklets, retirement handbooks, Medicare fact sheets, and so forth. Your retiring medical plan costs and plan comparisons. There's quick reference guides for medical and Medicare plans and which one is right for you. And then we have fact sheets for retiree health eligibility rules, CMS contact information, Social Security contact information, HICAP contact information, via benefits contact information, again, the RAS link and contact information, counseling and advisory services, which is a new service for the RASC. Retirement Association, you're here because of them. Their information and membership details are here. Health Benefits Office, Campus Benefits Office, and then, of course, your healthcare facilitators, myself and Lilia. She services employees A through actually M, not L. We need to update that. And myself, Ronisha, I service employees with the last names N through Z. Now we will open up the floor for any questions. You can either throw them in the chat if you haven't already done so, or unmute yourself and ask away. Thank you all for attending. I'm opening it up for questions. Any questions?
Yes,
Lilia,
I have
you
a
have
question.
anything? Oh, okay, go ahead.
Yes, you may have already gone over it. I just want to confirm it because there was so much information.
Yes, I know.
And it's just, I'm going to be 65.
Okay.
Work at UC, of course, UC Sandy. I'm an employee there in November. And I intend to try to work an additional 2 to 3 years. And from what I understand, I don't need to basically enroll in Medicare. I will have to do that when I retire. Is that correct?
Correct. You can do it. You can do it during the retirement process. Yes.
During the retirement process.
Yes.
Okay.
So when you start your retirement process, that they tell you to start at 90 days before your actual retirement date. So when that happens, that's when you should contact Social Security and start your Medicare enrollment process as well, 90 days before your retirement date.
Yes. Well, I appreciate all your help. That was a lot of information. I may have to start now.
It is definitely a
understand?
lot of information. I do. There's a lot of people that start way earlier than they need to, but I mean, I can understand why.
Yeah.
It's a lot.
Yeah, I'm just healthy and I've been working so long and if you want to know, I have 28 years with a UC.
Oh, nice. Congratulations.
And I'm going to try to get 30. People have been saying you should try to make 40, but I don't think so. I don't know if I'll make that. Thank you for your help. I appreciate it.
You're very welcome. And why is PPO behind Medicare Choice in parentheses? Is it really a PPO? Yes, it is really a PPO. I don't know where did you see a PPO? Maybe because we have two Advantage plans. One is a PPO Advantage and one is an HMO Advantage. or it might have just been a typo to have it in parentheses. But it is a true PPO. Sorry, my dog is acting up. Do we have any more questions? I see Lilia answered most of them in the chat. If you don't have any questions, I'm just gonna.
I've got a question.
Mhm.
You hear me?
Yes.
Okay. I'm retired already. I'll be turning 65 July 2nd. So, what I'm hearing or what I'm understanding is that I'd be getting something from RASC, probably 3 months before, so April or March.
Are you already retired or you're
Yes.
retiring?
No, I'm already retired.
Yes. So 90 days before, you'll get a packet. They call it an aging in packet. So it'll explain that you're eligible for Medicare. You're coming up to Medicare eligibility. And then it'll give you the form that you need to complete and submit to the RASC.
Okay. And then do I need to do something else with Social Security at the same time?
Yeah. Your first step when you get that packet, or the first step 90 days before your birthday, is to apply for Medicare. So that's the first step. So you can't even submit your UC paperwork unless you've applied for Medicare and been approved for Medicare.
Okay, so and I can't do it before like April 2nd, like the 90 days beforehand?
Right, because they will tell you it's too early and won't allow you to enroll in Medicare more than 90 days before.
And do you know how long their normal turnover is?
Roughly, I'm estimating roughly 6 weeks or so.
Okay, so that doesn't give you a whole lot of time to make sure that everything gets submitted within the 3 months, you know?
Well, yeah, it does. You still, because regardless of if, say for instance, they will approve you before you get your card. So what you can do is when you apply, maybe a week after you apply, if you go onto the Social Security website, that letter that we talked about, it will most likely be already on the Social Security website. So you can pull that letter, submit your UBIN form, and go from there.
Okay. And if I'm going to be on the blue and gold, I got the NHMO, the UC blue and gold. So that one was the UC, what was it called? For
choice. It's an advantage plan.
Okay.
So if you don't want an advantage plan, I know a lot of people are afraid of advantage plans. I just want to reassure you, the group sponsored advantage plans are totally different from those outside Medicare Advantage plans, original Medicare Advantage plans. So I suggest you look at our Advantage plan compared to the outside Advantage plans, number one, and then our Advantage plans versus our supplement plans before you make your decision during open enrollment. Because as of right now, when you turn 65 next year, if you're enrolled in blue and gold still, you're going to automatically go into that Advantage plan. Okay, so if you don't want to go into that Advantage plan, you should make your choice now during open enrollment.
Okay.
To get out of blue and gold and go into one of the PPO plans. So you'll go into a PPO and not an Advantage next year.
Okay. So that's what the other thing I was going to ask you is that for the open enrollment coming up, that's when I really need to decide. That's what's going to dictate what's going to happen for this year.
Yep. That's going to drive what you do for next year. Correct.
Okay. So if I needed to just maybe get some counseling dependent on, you know, what I currently have and what that calculates with the Advantage plan, could I talk to you about that? I'm a no in my last name. So could I actually meet with you to get some advice? Okay. Thank you very much. That's all I needed.
You're welcome.
Thank you.
You're welcome. I'm going to do some of the ones out of the chat. Can you explain how plans work with TRICARE? Well, with TRICARE, since it'll be triple coverage, Medicare will pay primary, TRICARE will pay secondary, and then whatever UC plan will be your third payer. Are the HCFs available to help with some complex situations regarding the spouse? Yes, send an email to that HCF help email. Lilia will, if you can put that in the chat, a case will be open for you and we can assist. Yes. How can we keep dental and vision insurance through UC if we're on Medicare? It doesn't make a difference. Dental will still come out of your pension check. It does not change anything just because you're enrolled in Medicare, because none of our Medicare plans include dental. Vision, if you're paying for that with VSP outside of UC, your Medicare enrollment does not change for that either. If primary retiree already retired, turns 65 later, will the spouse who turned 65 first get the proactive contact? Yes. Yes, your spouse will also receive that 90-day packet from the RASC. If you don't get the packet, send us an email and we can send you the UBIN forms that you need to enroll. But yeah, your spouse needs to enroll as soon as they turn 65, whether it's before or after you turn 65. I spend a lot of time in Seattle, but live most of the time in San Diego. What happens if I need medical care in Seattle? UC Medicare Choice is a PPO, so you are able to see a provider in Seattle if you would like to see a provider in Seattle, but you also have urgent and emergent care outside of California regardless, for all of our plans. So if you need to go to the ER or if you needed to go to urgent care or whatever, you will be covered. Is there an increased talk or reducing or no longer providing health care due to budget? Not for this year. I have not heard anyone talk about not having retiree health coverage at all. Premiums have been talked about going up this year. We don't have that information just yet. It won't be as drastic as it was last year. We do know that. But there is no talk about them not ever providing it at all. So, and a lot of different employers don't offer Medicare. So I think we're ahead of the game with offering Medicare plans in retirement. If you accidentally mess up due to all the requirements and lose UC health and welfare benefits, can you get them back? I want to say yes, but I can't say for sure. That's a RASC question. I have not had anybody that has lost coverage with and had to help them get it back, but I will if it ever happens.
Yeah, because you were mentioning that like if you get something in the mail that doesn't have the UCSD or UC logo and you accidentally sign up, are you like gone for good or can you recover?
Oh, with that kind of thing? No. I think if it's like lost due to like payment or something like that, I'm not sure how they could get that back unless they, recover full payment and stuff. But for something like that, you would just have to wait to open enrollment and then complete a UBIN 100 form and get back on.
Okay, cool.
But you would have to make sure your enrollment with that other plan that you accidentally enrolled in is terminated, and then you can get back in.
Yeah, I was just mainly, it seems like there are so many things, all the stars have to be aligned or something can go wrong. And I want to make sure that I could still, recover from that,
Right.
even if it takes a year or whatever.
Right. They'll most likely make you wait until open enrollment, and then that won't be effective till the first of the following year.
All right, I'll try to be good and behave.
Yeah, if not, if you have any questions, you can always reach out to us. We're available.
Thank you.
The link to the recording, I believe the recording is going to be put onto the Retiree Association's YouTube page, Vanya?
That's correct, yes.
Okay. I spend quite a bit of time in Europe. Does my UC Medicare choice with medical bills occur abroad? No, because Medicare is not recognized abroad. So you will most likely have to pay those costs yourself. How long are you in Europe? Is it longer than 6 months? Staney? Mr. Helson, Mr. and Mrs. Helson? So it's not longer than 6 months. Okay, then what will usually happen is if you have any urgent or emergent services that come up abroad while you're away, you would pay those upfront. Once you get back to the United States, you would submit documents to UC Medicare Choice for reimbursement. If you're somewhere where they can't give you bills in English, try to get them translated before you submit them, because they will ask you to translate any bills. Hopefully that answered your question. Any more questions? I'll also provide the PDF to Vanya, so slides can be reviewed as well.
Thank you so much, Ronisha. This was very
You're
informative.
very welcome. You're very welcome. There's no more questions. Hope you guys enjoyed the rest of your day. Have a great weekend. You're very welcome. And again, we're always available at hcfhelp@ucsd.edu. You're welcome. Oh, thank you, Lilia. Appreciate that. Is Staney still on the? Yes. You see the travel booklet on there, Staney Helson? Hopefully I'm saying your name correctly and not butchering. The travel booklet is PDF is in the chat for Medicare Choice.